Hey everyone, it's Dr. Alex from Atlas Orthodontics and the Holistic Orthodontist. I want to talk to you about the consultation process and the questions that you should be asking of the orthodontist and the orthodontic team when you're in their office during that consultation visit. Number one, you want to walk away understanding what the problem is that you have. You may come in with a concern and an idea of what you want to achieve, what your goal is. You want to make sure that the orthodontist understands what that goal is. And then a lot of times the orthodontist who has a more profound, deeper understanding of everything that's going on, how good are they at explaining that to you and helping you to understand what the actual treatment needs are. Then the next question is the how. How is the orthodontist proposing to correct those problems, and why is he suggesting those solutions? What kind of appliances will be used? And again, why will they be using those appliances? All these things should make sense. There should be clear communication back and forth, and you should be able to build a picture of what you're going to expect to see as the goal, the final outcome, how that's going to be accomplished. Also, are there going to be extractions? There's a lot of orthodontists that still do a lot of extractions, and sometimes that's really necessary, especially in adult patients that aren't growing, where it's a little bit more difficult if there's a lot of crowding. Sometimes we do have to remove teeth, but again, that's very, very much should be a last resort, and you should understand if that's going to be involved, if there's any extractions. Also, understanding how the orthodontic treatment is going to impact your day-to-day life. So if there's brackets and wires, what does that mean for your home care, for your brushing, as far as eating? If you're going to have treatment with Invisalign, how is that going to fit into your daily routine and your lifestyle? Those are the types of things that you want to ask as well. You want to ask about how long the treatment is going to last. You want to ask also what's going to happen after the treatment is completed. What's the plan as far as retainers and keeping the teeth straight? So once you have everything looking the way it's supposed to, fitting the way it's supposed to, how do we keep that for the rest of our lives and make sure that the investment of time and money and all the work that's being done is going to be protected? You want to also understand, what is the treatment going to look like in the office? So how often do you have to come to appointments? How long are appointments going to be? With brackets and wires, our appointments are going to be anywhere from 4 weeks to 10 to 12 weeks apart. With Invisalign, a lot of times you're going to be able to go 3-4 months in between appointments. So there's a convenience factor that you have to kind of bring into your lifestyle. A lot of patients talk to me about, we go away for the summer. We're gone for 3 months or something like that. We're from Japan, and we spend our summers in Japan, and how does that impact the treatment? So those are good questions to ask and to see how it would kind of dovetail again with your lifestyle. Finally, you want to discuss also the cost, the finances. How is insurance going to be leveraged into the equation to help make treatment affordable? If there's multiple children involved, how do we make it affordable for multiple children? What kind of payment plans does the office offer, and so on? That's important. Finally, the most important question is not the question that you ask during your consultation appointment. It's a question that you ask of yourself. And the question is, do I trust this orthodontist? How does it make me feel? Is this someone that when they look me in the eye, I know that this person is genuine, that they really care about me, that they care about my child, and that when there's complications or things that get hard, which sometimes they do, then is this person going to be backing? Is this person going to have my back? Are they going to back me up? Are they going to be there to support me and care for me no matter what? So I hope that's helpful to you. We look forward to having you come for a consultation here in our office. You're more than welcome, and I look forward to meet you.